Hy-Vee Pharmacy, this is Kristen. I'm a pharmacist. How can I help you?
Kristen, it's J.I. My husband came home with Pepto for our 7-year-old son. Our pediatrician warned us not to give him Pepto to any of our children. I'm really concerned. You're our pharmacy and we always fill our prescriptions at your place, but I'm not happy right now. I want to know which idiot sold my husband this item for our son when I sent him to buy Tums. I'm curious why you even sell a product called Children's Pepto.
Hi, J.I. I was the pharmacist who helped your husband earlier today, so I'd be happy to answer all of your questions. I sold your husband Children's Pepto, which is different than Pepto-Bismol. Pepto-Bismol contains bismuth subsalicylate, which can cause Reye's syndrome, so I'm thinking that's why your physician told you not to give that to your children. But Children's Pepto actually contains calcium carbonate, which is the same ingredient that is in Tums. Does that make sense to you?
Yeah, that makes sense. Makes me feel a little bit better too. Thank you for explaining that. Can you explain why you sold him Pepto though, instead of Tums or any other product? I just want to make sure it's the right thing.
Yes, of course. I'll explain the conversation I had with your husband earlier today in the pharmacy and how we reached the decision to pick Children's Pepto for your son. Does that work for you?
Yeah, I suppose.
Hi, how can I help you today?
Hi, Kristen. So, my wife, J.I., sent me to get some Tums for our 7-year-old, and I just need some help making sure that that's what I should get.
Okay, I'm going to ask you a few questions about your son, if that's okay.
Yeah, that's fine.
What symptoms has he been complaining of?
He said that he had a burning feeling that was rising towards his stomach, from his stomach to his throat.
Okay. Has he complained of any stomach rumbling, or has he been vomiting, or any diarrhea?
No.
Okay. Has he complained of any difficulty swallowing, pain while swallowing, or have you noticed any weight loss?
No.
Okay. When did his symptoms start?
It was just a few hours ago. He actually just finished 4 hot dogs, and he likes to use a lot of ketchup. So he started complaining shortly after that.
Okay. Has he complained of heartburn in the past?
No, he hasn't.
Okay. Does your son have any allergies?
No, nothing.
Does he have any medical conditions or any medications that we should know about?
Nope.
Okay. So since this is your son's first episode of heartburn, I would recommend making some lifestyle changes before you start using any over-the-counter products. So some of those lifestyle changes are going to include changing the way that he eats. So you're going to want him to eat some smaller meals throughout the day rather than that big, large meal at once. And then you're going to change the kind of foods that he's eating as well. So you'll try to eliminate or cut down on the fatty foods, spicy foods, chocolate, caffeine, tomato juice, and orange juice, so some of those acidic juices. And then you could also prop his pillow up at night, and that's going to help alleviate some of the symptoms of heartburn. Do you think you could do that?
Yeah, I think I can make those changes. But I really need to buy something to help him right now, because my wife told me to get Tums, and I can't show up without them. So we gotta just kind of help the kid out right now.
Okay, yeah, I understand that. I'll walk you out to the stomach aisle, and we can definitely find a product and go from there.
Okay, that sounds great. You should know that he cannot swallow pills, and he's really picky about the flavor or texture of the liquid of the liquid portion of the medications.
Okay, that's actually really helpful and is going to take away a bunch of products, so we'll definitely find something for your son here.
Okay, thanks.
This top care antacid is comparable to Mylanta. The ingredients include aluminum hydroxide, magnesium hydroxide, and simethicone. The patient does not have any symptoms requiring the anti-gas component simethicone. According to Lexicomp and the product labeling, top care antacid is not recommended for children under 12 years old. Liquids are typically better than tablets at neutralizing acid, but liquids were not an option since the child is picky. The active ingredient in Prilosec is omeprazole. It's a proton pump inhibitor, but proton pump inhibitors are not used for acute symptomatic relief. The product is formulated as a tablet, which the child will not be able to swallow. All over-the-counter proton pump inhibitors were ruled out. The active ingredient of Zantac is ranitidine. It's an H2 receptor antagonist that raises the pH of the stomach better than antacids do and provides relief for 6 to 12 hours. According to Lexicomp, it should not be used in children under 12 years old. This medication should be saved for use in appropriate patients if lifestyle changes have failed. It's not recommended in this case due to the child's age and the tablet formulation. The active ingredients in Gaviscon are alginic acid, aluminum hydroxide, and magnesium carbonate. The alginic acid forms a thick liquid that floats on top of the stomach when it interacts with saliva. This provides a barrier rather than neutralizing the acid. According to UpToDate, there have been conflicting results in the efficacy of this in improving symptoms. The aluminum hydroxide and magnesium carbonate are antacids, and this product is not recommended in children younger than 12 years old, according to Lexicomp, so this is not recommended for the patient. The active ingredient in Gas-X is simethicone. It helps to eliminate flatulence but does not help with heartburn. It helps bubbles come together and stops the rumbling feeling, but the child does not have that symptom, so this product will not work for this patient. The active ingredient in Beano is alpha-galactosidase enzyme. It helps to break down complex carbohydrates in food, making it easier to digest. Beano is used for intestinal gas or bloating in adults and children 12 or older. The patient does not have any of these symptoms, and the patient is only 7 years old, so this is not recommended. The active ingredient in Tums is calcium carbonate. Tums is an antacid that helps relieve heartburn, upset stomach, and indigestion. This is an option to relieve the child's heartburn because, according to UpToDate, it's safe for children 6 to 11 years old, and they may take the 750 milligram chewable tablets not to exceed 4 tablets daily. The same is true for Top Care Extra Strength Antacid Calcium. This is Hy-Vee's formulation of calcium carbonate. This is also an option to relieve the child's heartburn, and it's cheaper than Tums. The same is true for Children's Pepto. It's a lower strength of calcium carbonate, and it does not contain bismuth subsalicylate. This medication is for children 2 years and older, so this is an option for the child. Pepto-Bismol decreases secretions and coats the stomach to help with heartburn, nausea, upset stomach, and diarrhea. It does contain bismuth subsalicylate, which can cause Reye syndrome in children, so this is not an option, and all formulations will be excluded. The last product is Rolaids, which contains calcium carbonate and magnesium hydroxide. According to clinical pharmacology, the safety and efficacy of Rolaids has not been established in children, so this product is not recommended. Okay, so after looking at these products, I would recommend Top Care Extra Strength Antacid with calcium carbonate in it to provide some relief along with those lifestyle changes for your son. It contains the same active ingredient as Tums, but it's cheaper. The label doesn't say it can be used in children under 12 years old, but studies have shown that it's safe to use this in children 6 to 11 years old. You just can't exceed more than 4 tablets daily, which is 3,000 milligrams. Are you comfortable with that?
I'm still a little hesitant. The label doesn't specifically say it can be used in a 7-year-old.
That's correct.
Yeah, okay.
Okay, so if you're not comfortable with that recommendation, I'll go ahead and recommend Children's Pepto. It contains that same ingredient, calcium carbonate, but it's a lower strength, and the label says you can use it in children 2 years old and older. Are you comfortable with that?
Yeah, that would work.
Okay, this Children's Pepto should only be used for up to 2 weeks, so if symptoms persist longer than 2 weeks, you'll need to take your child to see a physician. Are you able to do that?
Yeah, I can do that.
Okay, and if your child starts to complain of symptoms like difficulty swallowing, pain swallowing, or you notice any weight loss, that's also another sign that you should take your child to see the physician. Are you able to do that?
Yep, I can.
Okay, that sounds great. While your child's taking this Children's Pepto, just watch out for constipation, so make sure your child's drinking plenty of fluids and just keep an eye on him.
Okay.
All right, do you have any questions?
No, I think you answered them all.
Okay, thank you so much for stopping in today.
Yep, have a good one.
Have a great day.